my name is Megan. I'm a student physical therapist assistant that's going to be working with you today. Let's head on back to the treatment room so we can get started.
Okay.
Go ahead and have a seat right here. So first, I'm going to sit right in front of you so it doesn't, so you can see me perfectly. I just want to start with some subjective questions, just see how you're doing today. So, are you having any pain today?
Yeah, a little bit. I'm a little lightheaded as well.
You're lightheaded, okay. So in this situation, I would check your blood pressure, but since I do not have a blood pressure cuff, I will just state that the normal range for blood pressure is 120/80 mmHg, and during exercise, your blood pressure will rise. So if the patient already has high blood pressure, you don't want to make it increase to a dangerous level, and if they have low blood pressure, they would be at a high risk for fainting and passing out during exercise. Okay, so with your pain, where would you rate it on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've ever felt?
About a 4 or 5.
4 out of 5, okay. And I just wanted to confirm this whiplash that you got from your accident. You know, your head got jerked forward really fast and jerked back really fast. So what we're going to be doing today, we need to be like pretty careful with it so we don't overstretch you and hurt you any further. But I do want to make sure that your activities of like the things you do every day, have you been able to do those without pain, or have they been like jerky motions kind of?
Yeah, I mean the movement has been a little harder, but
okay.
That's about it.
Is there any specific movements that cause your pain to be worse?
Just like bending.
Bending forward?
Yeah.
Okay. And I saw on your chart you were taking some pain medications from your doctor. Are you still on those, or are you taking Tylenol now?
Yeah, I'm still on them.
Still on the pain meds? Okay. Okay, so what we're going to be doing today is I'm going to take a quick measurement just so we can track your progress. That's something that your therapist was wanting us to do, is just to make sure and see how far you're getting with your range of motion, being able to move your neck a little bit. So we'll start with that, and then we'll get into some stretching of a muscle that's been tight for you. So I'm going to start with our measurement here. I'm just going to grab my little device. So I'm going to sit right next to you here.
Okay.
Just sit up nice and tall. And what I'm going to have you do first is bring your chin backwards, like tuck your chin in, perfect. And then look straight down at the floor whenever I instruct you. I'm going to line up my axis with his external auditory meatus. This stationary arm will be perpendicular to the floor, and the moving arm will be lined up with the base of his nose. Sorry, I got close to you there. So whenever you're ready, just go ahead, make sure you keep your chin tucked in and look straight down towards the floor. Bring that chin to your chest. As far as you can go for me.
That's about it.
That's about it right there? Okay. So it looks like we got from 90 degrees to 70 degrees. So it looks like he got to 20 degrees of cervical flexion. And the norm for that would be 45 degrees. So we do have a little bit to go to get you there, but our stretches should help with that. I have a timer here so we can make sure our stretches are at the right time, but let me get this set up and then I'll show you. Okay. So for the stretch, we're going to be stretching a muscle called the levator scap. It's in the side, kind of the side and the back of your neck, and that tightness is what's causing your flexion, like bending your neck forward, to be kind of restricted and limited. So a really simple stretch I'm just going to show you, and you can take it home with you. We're going to do we're going to hold the stretch for 20 to 30 seconds, and we'll do it 3 times on each side. That way we can get each side stretched. Is there a side that's causing more tightness than the other, or that's in more pain than the other? We can start there. Or is it just
no, it's
okay.
Not the same. We'll
start with the right side. So what we're going to do, I'm going to instruct you first and then we can get into it. So what we're going to do is tuck your right hand behind your back as much as you possibly can. And then what we're going to do is we're going to grab the side of our head with our left hand, and we're going to pull it down and kind of sniff your armpit. You don't need to sniff your armpit, but that's just kind of the motion that we're going to be doing. Just kind of come down and kind of act like you're sniffing your armpit. And with your left hand, what we want is for that to help you pull into a deeper stretch. So go ahead and get started. Yep, with your hand behind your back, and use that hand and tilt as far as you can.
Okay.
Right, is that as far as you can go?
Mm-hmm.
Looks very good. Okay, and how are you feeling?
Good.
Okay, and what are you feeling right now?
Well, it feels a little tight, but it's stretching it out.
You feel a stretch, and where do you feel that at?
Right about here.
Good. I just want to make sure you're feeling that in the right spot. Oh, I forgot to start my timer. I'm sorry. So I started it at 20, and we'll just add on to that 10 seconds that you've probably already done. Okay, and go ahead and relax now. And then we'll do that 2 more times, so just take a second to relax, and then whenever you're ready, go back into the stretch again. You look pretty good doing it. So whenever you're ready, sounds good?
All right, I'm ready.
Okay, I'll hit start. Six, 5, 4, 3, 2, 1. Okay, and go ahead and relax.
Okay.
And then we'll do that 1 more time on the right side.
Okay. I'm ready.
You ready already?
Mm-hmm.
Okay. Whenever you're ready, go ahead and start.
Is that right?
Yep. You're doing good. Okay. Go ahead and relax. And then we're going to do the same thing on the other side, but you'll tuck your left hand behind your back and pull your head towards the right side.
Okay.
Same concept, different direction. So whenever you're ready there, we'll go ahead and get started.
Ready.
Okay. You feeling the same thing on that side you did on the other?
Mm-hmm.
Good. Okay, go ahead and relax. Should help with some being able to bend your necks a little bit more. Yeah, which however you need to be more comfortable.
Okay, I'm ready.
All right. Okay, go ahead and relax. And then we'll do that 1 more time and we'll be done for the day. We just wanted to get some stretching in.
Okay.
And again, this is a very simple stretch that you can take home and perform there.
Okay, and I'm ready for the last one.
Okay. Alrighty, and we are done with that. So again, you can take this exercise with you home. We'll do exactly what we just did, 20 to 30 seconds, 3 times on each side. And our goal would be for you to be able to do that twice a day. So maybe when you wake up and when you go to bed, or whatever 2 times work best during the day for you.
Okay.
Do you have any other questions for me?
I don't think so, not at the moment.
All right, sounds good. Well, you have a very nice day, and I'll walk you out towards the front.